Good evening. Welcome to another conversation on COVID-19 in Barbados. Over the course of the last few days, we have been discussing the rollout of the latest directive, what is to happen when the country goes on national pause. We've been reminding you that no matter what happens, the key step to protecting yourself is wearing your mask right so that it covers your nose, your mouth, your chin, and to make sure that there are no open gaps on the side. Make sure that you wear, apart from wearing your mask right, that you keep at least 6 feet away from people who are not members of your own household. Wash your hands often, and if you can't get to soap and water, use sanitizer. These are the measures that help you protect yourself from COVID-19. Now, we know that you want to safeguard your family members, and it's therefore important for you, particularly with elderly members of your household, to take particular precaution with them. We've seen over the course of the last few days some deaths among the elderly, particularly those with pre-existing conditions, with comorbidities like diabetes and hypertension and strokes and heart conditions and other illnesses. So be careful, especially around your family members whom you know to be ill or suffering with these particular conditions. This evening, to discuss the national pause, there are 3 guests. We have the Attorney General, the Honorable Dale Marshall, who will dive into the directive. He's going to drill down, as people like to say, give us some details on what we can and cannot do, what the directive means, what the pause means, what is going to be allowed and what is not. Also with us this evening at Illawarra Court are Senator the Honorable Jerome Walcott, who is Minister of Tourism, but he is here, I beg your pardon, Minister of Foreign Affairs, but who is here in his capacity as chair of the Cabinet Subcommittee that has responsibility for matters related to COVID. And joining us by Zoom is Dr. Joy Su, who is consultant psychiatrist at the psychiatric hospital, and she has particular responsibility not for resident patients, but for the community. And the impact of COVID-19 on communities, on individuals, on families, on societies is of particular importance. People say that they are afraid. Now that we are going into a pause and people are going to be at home again, what does this mean and how can they cope? So those are our 3 guests. We are preparing for the pause, and Attorney General Marshall will speak to that, how we are going to keep in the pause, Dr. Walcott, and then coping with the pause, Dr. Joyce Su. We're going to start with the Attorney General. Thank you so much, AG, for being with us today. Please, people are still unclear. What does the pause mean? What can Barbadians do or not do? What kinds of enterprises are going to be allowed to open? Who can be on the streets and to do what? What hours are we to be off the streets? Well, are we to be on the streets at all? These are the kinds of questions that people have been asking, and we need you to tell us and to guide us what this pause means for Barbadians and for Barbados. Sir, you have the microphone.
Good evening, Barbados. Thanks very much, Liz and colleagues, Dr. Walcott and Dr. Su. I'm happy to be able to address you briefly this evening on something that I know you would have been quite curious about. Let me begin by saying that the protocols that we are putting in place, the directive that we're putting in place, draws significantly from our experiences last year. Last year, you'll know that that was the first time that we've ever had to take our country into a period of shutdown. And a lot of it was new to us. Fortunately, I don't think that we made any huge errors but certainly we've learned from some of the missteps that we may have made on the last occasion, and we've tried in many ways to tighten up, but also to allow flexibility in circumstances where flexibility is required. Much of what I'm going to talk about is familiar, and much of it is also intuitive. So, for example, in a period of shutdown, we want Barbadians to stay at home. That is the overriding principle, and that for us is the overriding objective. Barbadians are to stay at home simply because interaction and heightened interaction increases the risk of the spread of the virus. And that is where this directive is intended to take us. But obviously, in asking Barbadians to stay at home, we do need to make provision for certain things to continue as per usual. And we've called those things essential services. Essential services are doctors, the fire service, police officers, paramedics, security officers, and a whole raft of things which, when you think about it, the country could not function on a day-to-day basis without. So during this period of lockdown, there's a blanket stay-at-home requirement, but we begin by saying that essential services are allowed to and indeed expected to operate as normal. Nobody would want to turn up at the Queen Elizabeth Hospital or the doctor's office and hear that they couldn't have access to medical attention because of a shutdown, and those individuals could therefore not attend their place of work. Nobody would want to know that they could call the fire department and hear that it was closed because those individuals were at home during this lockdown. So at the outset, essential services are required to attend their place of work. Essential services therefore includes things like telecommunications, electricity, water, those things that are necessary for our day-to-day existence and survival. But it's also obvious that we needed to add to that suite of operators another set of individuals who are going to be allowed to operate, again, so that Barbadians can, even though we're fighting COVID, have some level of basic normalcy to our existence. And therefore, we began by asking ourselves, what are those fundamental things that Barbadians need to have access to? Obviously, farmers need to operate because they have livestock to attend to. They have crops in the field. And the notion of a farmer leaving his livestock for 2 weeks or leaving his crops unattended for 2 weeks is really not something that we could countenance, not just because of its economic loss, but also because we rely on those things to sustain us, to feed us. So there's certain things that are going to be allowed to happen. I'm reluctant to go through the full list with you, but I think it would be important for me to do so, and I believe that we have it, that we can put on the screen at some point in time during the afternoon's proceedings. But before I get into that, let me put to rest the notion that on the 1st and 2nd of February, there's going to be the Wild Wild West in Barbados, simply because some people believe that there is going to be no effective directive. That has never been the case, and it is not going to be the case. It is because of well, there are certain reasons why we chose to implement these particular measures from the 3rd of February. But the current directive, all of the regime under which Barbadians are currently living and existing, these directives are going to continue for the 1st and for the 2nd of February. So for those people who seem to think that on the 1st and 2nd of February, there are no protocols, you can go where you like, you can do what you like, that is obviously not on. On the 1st and 2nd of February, the current regime will continue. But from the 3rd of February, we will then have the new directives. Now, as I said, much of it is familiar to you. So during the last shutdown, we kept bakeries, bread depots, and things of that sort open. That will continue on this occasion. So I can say to you that bakeries and bread depots for the sale of bread will be allowed to be open from the hours of 9 a.m. and 4 p.m. And bakeries for the baking of bread, which is to be distinguished from the selling of bread, will be allowed to operate from 9 a.m. from 7 a.m. to 5 p.m. Conscious of the fact that there are certain financial arrangements that have to continue, we are going to allow banks and credit unions for the first part of this shutdown, and that is to say from the 3rd of February to the 10th of February, to provide back office services. In other words, they can provide those things that support credit cards, ATM, electronic payroll, night deposits, and things of that sort. But what they cannot do is engage in face-to-face retail banking. So from the 3rd to the 10th, banks and credit unions in Barbados will not be allowed to do things which require face-to-face interaction with members of the public. They're going to be able to do all of the background, back office supporting services, but not face-to-face. But from the 11th of February until the end of the directive, they will be able to return to retail banking. Let me say that we've had a lot of questions. Will Western Union be able to open? The answer to that question is no. If we're stopping our banks from doing face-to-face, it stands to reason that we would prevent money services like Western Union and so on from doing face-to-face. So that is, that is absolutely consistent. However, mindful of the fact that Barbadians do have bills to pay, and paying your bills late results in penalties and so on, we will be permitting bill payment services such as SurePay to operate in wherever locations they exist between the hours of 8 a.m. and 3 p.m. Monday to Friday. So your bill paying services, you'll be able to go to wherever you currently go to do your bill payments between the hours of 8 a.m. and 3 p.m. Monday to Friday. Cleaning services will also be allowed to operate. It stands to reason that institutions that are essential services, hospital clinics, and a whole variety of other facilities need to have professional cleaning, or supermarkets and so on. So we are allowing cleaning services which companies will be cleaning for essential services and for exempt businesses to perform those services. But in addition, we recognize that there are some places, commercial places, which require cleaning periodically for environmental purposes. So to the extent that that is going to be necessary, that will be allowed. Delivery services has taken on significant importance during this COVID time. We've had a lot of requests to allow online activity. Bottom line is we're closing businesses, so that's not going to happen. However, we will be allowing deliveries for the purposes of delivering groceries, fruit and vegetables, and medical supplies, and they'll be able to operate between the hours of 8 a.m. and 6 p.m. Obviously, if supermarkets and so on are going to be allowed to open, people who are supplying the farming trade and so on, if they're going to be allowed to open, then distribution channels are also going to have to be facilitated, and we're therefore going to allow the distributive traders for the supply of goods to essential services and businesses that are exempt to do deliveries between the hours of 7 a.m. and 5 p.m. Farms will be allowed to continue to operate between the hours of 6 a.m. and 6 p.m. Fuel manufacturers, fuel storage facilities, and fuel distributors will be allowed to operate for the entire day. And when we say for the entire day, we're really talking about 24/7. Gasoline stations presented some challenges for us on the last occasion. And we're mindful of the importance of gasoline stations to keeping Barbadians on the road. But equally, we want to make sure that we eliminate that side of gas stations that encourages people to congregate and so on. So we'll be allowing gas stations to open for the sale of products relating to motor vehicles, petroleum products, including LPG, we call it bottled gas, and they will also be able to engage in the sale of top-ups of mobile phones and pharmaceuticals. Every gas station has aspirin, Panadol, inhalers, and things of that sort. So you will be allowed to buy those. But gas stations will not be allowed to sell items for human consumption, including intoxicating liquor, other than the pharmaceuticals that we just spoke about. So in other words, you will no longer be able to pop into the Automart for hot dogs, hamburgers, juices, beer, and things of that sort, bread and so on. Once again, we'll be allowing hotels, villas, and other rental accommodations to operate, but they will not be allowed to operate gaming rooms, spas, gyms, discos, and those kinds of ancillary things for the entertainment and satisfaction of their guests. They'll be operating at a bare bones level, and in this instance, this is the only occasion where we will be allowing restaurants to open. That question has come fast and furious. Will restaurants be able to open? The simple answer is no. Restaurants will not be able to open for delivery, for curbside, for takeaway, for any purpose. However, if those restaurants are situated within a hotel or something of that sort, they will be allowed to operate for the purposes of room service only. So we'll have no in-restaurant dining, as people have asked if they could facilitate. Restaurants are open in hotels for room service only. The manufacturing sector is important to us, and we will therefore be allowing manufacturing companies for the provision that are producing goods for export to operate. We will also be allowing manufacturing companies that manufacture animal feed to operate. Pharmaceutical manufacturers, manufacturers of beverages, dairy products, food processors, and food distributors, they'll be able to operate within the hours of 7 a.m. and 5 p.m. Pharmacies, for personal shopping and the filling of prescriptions, they'll be able to operate within the hours of 8 a.m. and 4 p.m. Now, the question of mini-marts has come up. You will be aware that we've taken the decision that we will not be allowing any rum shops, village shops, corner shops to open. We understand the importance of these facilities to communities, but at this point in time, we're asking Barbadians to bear with us for this very, very narrow window for the benefit of the health of all concerned. But mindful of the fact that many communities in Barbados are served only by mini-marts, and mindful of the fact that in many areas, especially rural Barbados, we don't have supermarkets available, we feel it is important to allow some mini-marts to operate. If they don't operate, and I speak about St. Joseph, that's the place I represent, that's the constituency I represent, the St. Joseph people will then have to journey to the north to Jordans or down to Warrens or south to Emerald City, and all that will do is put more Barbadians on the road at a time when we want to reduce the numbers of Barbadians on the road, generally speaking. And therefore, the Cabinet Subcommittee has agreed that certain mini-marts in rural Barbados will be allowed to operate. Of course, the question you'll be asking is, what are those mini-marts? We've been engaged in a significant amount of consultation over the last 2 days in order to be able to refine that list so that we're not unfair to any districts. And to be frank, there are some mini-marts that will not be allowed to open. It's not a perfect situation. Minister Simmons said yesterday, the Prime Minister said a few days ago, there will be some inconvenience to people. We're trying to be as fair and as balanced as we can be, and therefore, if you have 4 mini-marts in one community, it would be reckless of us to allow all 4 to open. So in those instances, we have to try to find a way to select the one that benefits the largest number of people. We expect that list will be available for publication possibly tomorrow, no later than Monday, so that people will know which mini-marts will be allowed to open. If your mini-mart is not on that list, if the mini-mart in your community is not on that list, it has to remain closed. Private veterinary services will be allowed to operate as needed. Sugar factories will be allowed to operate for the entire day. Supermarkets will be allowed to operate between the hours of 8 a.m. and 4 p.m. And I should make it clear here that mini-marts will operate on the same terms. Those mini-marts that are allowed to open will operate on the same terms as the supermarkets. That is to say, mini-marts 8 to 4, supermarkets 8 to 4. Mindful of the challenges of closing places with pools at this point in time, and mindful also of the significant threat of dengue, and the Prime Minister has made it clear that at this point in time, we're not just battling COVID, but we're also battling dengue. We're going to allow swimming pool services so that those swimming pools can be kept clean and are not allowed to stagnate over the next 2 periods. I'm informed that swimming pools, if not attended to, can stagnate very quickly, and we want to make sure that there's no opportunity for the growth of mosquitoes, and therefore we'll be allowing swimming pools to be clean, not for the benefit of individuals who own those pools, but purely for the purpose of ensuring that we keep the larvae and mosquito population down. On the last occasion, tire shops and so on became a pressing issue, and while they were closed in the early state of the last shutdown, we've taken the decision to allow tire shops, record services, and emergency personnel for vehicle response only to be able to operate as needed. So if you have a flat tire, you can get it fixed. If you're broken down on the road, you can call a wrecker. If you get into an accident and you need to call the emergency personnel from your insurance company, you can do that, but only in those circumstances. Wholesalers of food items and associated supplies, for the limited purpose of fulfilling orders, they'll be able to operate between the hours of 8 and 3. What I want to make clear is that even though the government has taken a decision to give certain exemptions, we'll be expecting every enterprise that has been given the benefit or the privilege of an exemption, we'll be expecting them to operate on a skeleton staff to the smallest amount that is safe. So if we've given you an opportunity to operate and you normally have 200 members of staff, we're not going to agree that you can bring out all 200. But if you can operate your business safely on 50, at a time like this, we're expecting that you will oblige us and you will cooperate with us by bringing out the smallest number of people that can run your business safely. Let me make it clear that while we're closing businesses, any enterprise that is able to have its staff members work from home, you'll be allowed to function. So lawyers, accountants, other service providers, if you can operate from home without having to interface with the public, without having to leave your home, you will be able to operate. The question of maids has come up time and time again, and I want to make it clear. Maids for residential properties and nannies and things of that sort, gardeners and things of that sort, that will not be permitted. As inconvenient as it may be, this is important to safeguard the health of all Barbadians. So you will not be allowed to bring your domestic worker into work. You'll not be allowed to bring your maid into work. You'll not be allowed to bring your nanny into work. You'll not be allowed to bring your gardener and other personal providers of that sort. They will simply not be operated. Finally, let me say, well, perhaps not finally, we've had questions about what happens with churches and so on. This is not unfamiliar to you. Once more, we're going back to the situation where churches can stream their religious bodies can do their streaming as and when they have services set. 10 people for streaming, 10 mourners for funerals, the bride and groom in the case of a wedding, and with them, as is required by law, 2 witnesses and the officiant. So this was how it was last year, so it's not unfamiliar to you. Unlike the current situation, you will not be allowed during this shutdown to ask for additional mourners. That is simply not on. So you're limited to 10 mourners, plus the funeral director, the officiant, and staff. In the case of a wedding, the bride and groom, 2 witnesses, and the officiant. In the case of a regular church service, a regular religious service, just 10 people for the purposes of streaming. in relation to exercise and beaches. We've had many calls about this. Let me reiterate that beaches and parks will be open between the hours of 6 a.m. and 9 a.m. You have a 3-hour window, 6 a.m. and 9 a.m. Those beaches and parks are open for the purposes of exercise only. So you can go to a beach and park to swim, to dive, to run up and down as you wish. But the window is 6 a.m. to 9 a.m. and that's all. There's no second set later in the day. Many Barbadians, though, want to exercise outside of a beach or park arrangement, and therefore we're allowing no more than groups of 2 during that same window, 6 a.m. to 9 a.m., to be able to exercise. So if you're accustomed doing your jogging or whatever it is, you can do that 6 a.m. to 9 a.m. But let's make it clear that the stipulation in this instance is that you must be in a group of no more than 2 persons. So 2 people can go jogging in the morning. In every instance, you're required to be physically distanced. Perhaps the most draconian thing that we've had to grapple with here is what we do about wearing face masks in public places. I think Barbadians will recognize that there are a number of places. I can say to you that the COVID unit had to do a cleanup of Fairchild Street yesterday, simply because of the large number of people who were gathered in that district, liming, socializing, buying drinks, waiting until transportation came to get home, and not wearing masks. This is a huge problem, and therefore we are for the first time stipulating that if you are in a public place, you must wear a mask. Now, this is what pertains in other jurisdictions, and we've been loath to come to that, but we feel that we are now at the position where it is the appropriate time to make that stipulation. So as long as you leave your home, you're going to be required to wear a mask. As long as you leave your home, you'll be required to wear a mask. Obviously, though, there are going to be some exceptions. And those exceptions are perhaps quite obvious. There are people who can't wear a mask or a face shield or any kind of face covering because of some medical condition. That medical condition may be mental, physical, or it may be some other kind of disability. In that instance, you'll be permitted not to wear a mask. If you are traveling with another person and that person has to do lip reading, then you will not have to wear a mask. Where you are eating, drinking, or taking medication or exercising, you'll not be required to wear a mask. If a person, when you enter a building, asks you to take your mask down for the purpose of establishing your identity, you wouldn't have to wear it then either. But other than those limited situations where it's medically required, or where you're eating, drinking, or taking medication or exercising, as long as you leave your home, you'll be required to wear your mask. Many of the same protocols continue, that you're not allowed to visit any place of quarantine, you're not allowed to attend or host a party, a line, anything of that sort. Let me say here that sporting activity is out. So unlike previous occasions when you could engage in some kind of sports, sporting activity is absolutely prohibited. Whether it is alone sports or joint sports, whatever it is, sporting activity is out for the duration of this lockdown. This directive will be published in GIS, and our PR team is busy working on the messaging, and therefore I don't expect you to remember every word that I've said. I anticipate that very shortly the details of the directive will be able to be published so that you can see for yourself what is allowed. Let me just reiterate, I know I'm taking long, but let me just reiterate here. All businesses are closed. You may be the biggest insurance company in the world, the biggest law firm in the world, the biggest accounting firm in the world. You could be doing every single following every single protocol. You are closed. You can work from home if that's workable for you, but other than that, you are closed. The only businesses that are allowed to open, only enterprises that are allowed to function, are those that are essential services or those that I've indicated to you are exempt. I hope that I'll have the opportunity to clarify any issues that might arise. I've not tried to cover everything, but as I said, the directive will be published so that you'll be able to see for yourselves the specifics of the directive. Liz?
Thank you very much, Attorney General. Just one question, please. Can you remind the public of this period of national pause? What are the dates?
The dates are from the 3rd to the 17th. And I had an interesting discussion today, so let me make it clear. When we say the 3rd, we mean all day on the 3rd. When we say the 17th, we mean all day on the 17th. So what that means is that from the moment the 2nd of February ends, whether you say it ends at midnight or a minute past midnight, doesn't matter, but from the moment the 2nd of February ends, the 3rd of February begins. I know it may seem like a trite statement, but I think it's more important to make it. So from the 1st, 2nd, and the 3rd of December, the 3rd of February, these curfew and other provisions come into effect. And they end on the last second of the 17th of February. So from the first moment the 3rd of February begins to the last moment that the 17th of February exists is the period of our pause, our further curfew period.
Thank you very much. And we want to remind the public, where possible, to pay your bills online. I know that for older people, sometimes you're a little intimidated by the technology. I have that issue as well. But get a younger family member to help guide you through the process. It's not as complicated as you think, and you can get it done, I'm sure. In addition to that, where possible, order your groceries online and have them delivered. Try to stay off the road. The whole idea is to keep people out of other people's houses. Thank you very much, Attorney General. We move now to the Honorable Jerome Walcott, who is chair of the Cabinet Subcommittee dealing with matters related to COVID. The minister is a medical doctor, a surgeon, and he is well equipped to tell us what is going to be happening during this period of pause. How are we going to be keeping the pause? We have heard that there is an Operation Seek and Save, which is a community-based intervention intended to identify and care for every single individual who is at risk, who may have COVID. Dr. Walcott, can you tell us, please, a little bit about the decisions of this subcommittee of the Cabinet, what is going to be happening during this period of pause, what prompted the decisions, why it's important to Barbadians, and what we can expect the Ministry of Health and Wellness to be doing during this period? Of course, Minister Bostic will come to speak to this again, because we need to keep reiterating it and to guide and walk Barbadians through this new experience and through this new initiative. But the point is that communities and individuals who live within these communities are going to be, we're going to reach out to them, the ministry is going to reach out to them in an effort to interrupt this cycle of COVID that we are seeing in the country by finding, by seeking, by saving every individual that possibly can be saved. Dr. Walcott?
Thank you, Ambassador, and good evening to all Barbadians. I'll start with briefly about the subcommittee. The Cabinet Subcommittee with responsibility for the coordination and implementation of this country's national COVID response plan. As you said, I'm the chair. It comprises of a number of other ministers. Certainly the Attorney General sits on that committee. Obviously the Minister of Health and Wellness, Minister Bostic, We know that COVID affects a number of areas in the country. Minister Bradshaw is there. There are issues related to education. Minister Colin Jordan is there. There are matters related to labor from time to time. Minister McConney from Information and Science and Technology, obviously as it relates to the use of the technology and in helping a number of the ministries to function, be it in terms of the SHAPE system or as it relates to other matters in other ministries. Minister Abrams was very active in the last couple of weeks. We have the issues related to the prison. Minister Cummins with the issues related to tourism, and of course you, Ambassador Thompson, bringing it all together and helping us to get our message across. This committee is a very active and busy committee. Numerous meetings, obviously towards the end of December and early January, we've been extremely busy having meetings, sometimes 2-3 times a day, going from early in the morning to late at night. And I think recognizing the importance of us to coordinate this COVID response and implementation of the matters that the decisions that we need to make. Obviously, the Prime Minister participates in these meetings from time to time and assists us in some of the decision making. You're correct, in this period of lockdown, we have decided inter alia to implement a COVID-19 community evaluation survey, and not a research plan, but a survey with a difference in that in this survey, we are planning to gather information, but also to act at the same time in parallel. At the outset, I should say, all of us know the tenets in management of infectious diseases. It has to be risk assessment, risk management, containment, and reduction of transmission. We recognize that at this point in time in Barbados, the COVID, we've seen community spread. We have seen cases popping up all over the place. This period gives us the time, the space to be able to assess our situation, and most importantly, try to identify where cases may be and which we will not normally come across. And we came to this decision as a result of the occurrence recently in the last 2-3 weeks of a number of persons presented quite advanced in their illness to the Accident and Emergency Department. And members of the public will be aware that a number of persons passed at A&E and went to the Harrison's Point, and perhaps within 24-36 hours would have demised because of their condition. We also noted that a number of persons were presented fairly ill. We were going to Harrison's Point, and this was occurring because some of them were speaking about dengue fever. At this point in time, the effects and the COVID is being mitigated and, should I say, clouded by the presence also of dengue fever in our society at the same time. There are similar symptoms to some extent. There's an overlap of symptoms. Certainly the headache, the muscle pain, the fever, these are common to both diseases. And oftentimes persons self-diagnose, or in some cases they've been told by medical practitioners they have dengue fever, and the focus is there. We recognize that we need to get to these persons. And what we've come up with is this community evaluation survey, which the ambassador titled the Seek and Save. As I said, we're going into the communities, we are trying to identify persons who might be symptomatic, who might be suspected cases of either dengue or COVID, and then there'll be another group coming in shortly thereafter to do the testing in situ in their home. In terms of the structure of this, we're working collaboratively with the University of West Indies. As I speak to you, the recruiting is going on. There have been hundreds of volunteers for this process. We are looking at about well over 300 persons to be utilized. They will be provided with the necessary ID, photo ID. They will be using smartphones. There's no paper and there's no pencil and pen. We're utilizing, there'll be a link connected to the UE cloud system. They go on this, they go to a household, they click on the link, they pull down the link, and they go through a series of questions, including, as part of the process, obviously, is a geo-tagging of that residence for obvious reasons. It goes through, it's a survey that should take about, I believe, about 7 minutes. It covers a number of health issues, COVID-related, dengue-related, and not all questions, but also some observation as it relates to certain environmental matters, concerns around the area, if there's collection of bush, if there's water, all of these things which might allow for the vectors of dengue to be transmitted. It is expected that this information will be transmitted real time to the central area at the University of West Indies, where all the processing and the database will be held and an analysis will be done. And it is expected to have, like, every 2 hours information being churned out, indicating where hotspots are, potential where someone who has symptoms or who might be suspect of having COVID or needed benefit for the test, to allow a series of mobile teams which we will have comprising of medical personnel, nursing personnel trained in swabbing. And these will then go to the individuals in their location, recognizing, of course, again, a benefit of the rest period or shutdown, if you want to call it that. In that, for example, I went to the house of Mr. Smith, and Mr. Smith has symptoms and signs of perhaps of COVID. It's him, his wife, and perhaps one child. We will have obviously indicate that that person will be called, eventually will be tagged, and will be informed that they will need a test. The test would be done. We're going to be offering 2 tests, the antigen test and, of course, a PCR test. If that antigen is positive, obviously, while we wait for the confirmation of the PCR test, the persons will be asked to continue in that location, not to leave. And I say this because this is important. Some persons are wondering, if you go to a household and you find someone is symptomatic, why don't you send them to the polyclinic? Why don't you send them to the testing center without thinking that then you expose them, if perchance they're positive, to other persons on their way to the polyclinic or indeed at the polyclinic? So we think the most effective way to do it is to try and test those persons at home. Persons are concerned about strange people coming to their houses. These students will have their masks, will have shields, they'll be using sanitizers, they'll be at a distance from you. We are not asking you to come out and to shake their hands and to embrace them. We are asking you to be courteous to them. They're going to be asking questions, they're seeking to help. They're not trying to be inquisitive or malicious, they're just trying to help. We need that valuable information for us to try to identify the incidence of COVID in the community. We know we are seeing the cases, but we want to go and to be preemptive and to find those cases in the community, isolate them where necessary, and so assist in the containment and the reduction in transmission of the disease.
To put to you what has been a major concern
Certainly.
that has been raised, and it is the whole question of security for elderly people and how they're going to be able to identify these teams as opposed to people who might be coming to the house trying to run some kind of scam.
Mm-hmm. Well, we're going to, as I said earlier, they will have their name ID, and in those cases, we're certainly looking at enlisting some people in the community who are well known in the community to be of assistance. And I've asked some of through the Ministry of People's Empowerment to identify some of those people who can be of use. At the end of the day, we don't want a whole set of people on the street, but individuals who know some of these elderly persons. And in the community, as you know, Ambassador, sometimes the neighbors would help them in this situation. Persons are wondering if we'll be able, the Prime Minister spoke about a house-to-house survey and going house to house, and it sounds unreal. I'm simply saying that we're going to be using the polling divisions. We have over 300 students. There are 30 constituencies in Barbados. We've worked out the time it takes to complete the questionnaire. That is the student asking the questions and making observations. We've worked out that they can easily do 4 households in an hour. We expect students to work perhaps to 6 hours in a day. There are 360 of these students going around. Working, that'll be seeing about 24 households per student per day. And the duration of the program is expected to be 12 to 14 days. We know that we have roughly just under 100,000 households in Barbados, so it can be done. Once we have the public, being cooperative and recognizing the importance of this. COVID is in the community. we are going into the communities to try to identify any suspected cases or persons who might be symptomatic, who might not be aware that they have COVID, and try to identify, try to test, try to determine if they're positive or not, and most importantly, to treat as early as possible, and so prevent the deleterious effects that we have recently seen, especially among our elderly folk, and that is what we are trying to avert.
Thank you, Minister. We do have a sample of 2 of the health questions that we can put up on screen for members of the public to get a sense of what will be asked. I believe that they are available. Yes, they are available. So we're going to show them in a minute. But Minister, perhaps you might wish, while the technical people are preparing, to talk a little bit about the importance of telling the truth. When Dr. Ward was here last week, he spoke to the fact that often people are not full and frank with their information, either out of fear or because they think it is personally sensitive, or there may be indiscretions involved or other aspects of their personal business that they are reluctant to reveal, and therefore you do not always get a full picture. Can you guide us a little bit in relation to how?
It is a problem that the health sector is being faced with, not only in contact tracing, but certainly even when, you're asking persons. I've been told by Dr. Ford, sometimes people are reluctant they will tell you that they're asymptomatic. When you question them further, you recognize that they've had symptoms, they're trying to hide them. There's this fear of identification, that you will be identified as having some contagious illness. There's a fear, and I think we covered it in an earlier program, the fear of being quarantined, the fear of being in this isolation. Some people describe it as horrors. We know it is not like that. We know that if you go to and Ambassador, you've been there, the relationship between individuals who are there is not what people fear. It is not like where they talk about being like a prison or concentration camp. That is not how it is there. It is a health facility with all the recreational facilities and all of this, and they take excellent care is taken. But I fear that when people are not truthful, then the doctors are not able to manage the disease, perhaps as aggressively sometimes. We well recognize that with COVID, you can go from just a slight cough in the morning to have respiratory distress by the evening. So it is absolutely important that people, be truthful, and even caregivers with some of the elderly people, rather than saying that she just has a cough or a slight cold. A slight cough or cold to an elderly person could be an early stage of respiratory distress.
Thank you. I just want to share with the public, I think it is known that I spent 22 days in Harrison Point. And as people now face the possibility of having to go into isolation because they are diagnosed as perhaps asymptomatic, no symptoms at all, but definitely positive for COVID, or they have symptoms and they don't recognize that these are symptoms of COVID, or they have symptoms and they really are afraid. I want to say to you that what the minister said is right. Harrison Point and the isolation facilities are not luxury hotels. They are not home. They are medical facilities. I can tell you that the care is exceptional. And I was not treated any differently to any other patient. I saw what other patients received. It was all the same. Dr. Corey Ford and the team that he leads are exceptional health professionals. Even the cleaners and support staff, whether it's the lab techs, the people who do x-rays, the medical checks, the medical care is exceptional. It is world class. And while we have focused a lot on slow turnaround times in the lab, and let's face it, every country in the world has had its health systems overwhelmed by COVID. The reality is that there isn't anybody who has gone into our isolation facilities and said that they did not receive exceptional care. They may not have liked the idea that they were not at home. They may not have liked the idea that they couldn't do exactly what they liked when they liked all the time. But this is a medical facility, and like being in any other hospital, there's a structure and there are rules that you have to follow. I didn't like getting up early in the morning, but I had to. The point is that if you go to where you can be cared for, not only will you save your own life, but in particular, you can save the life of a loved one. Because even though you may not break down yourself, COVID can easily take somebody you love away from you. And I know that nobody wants to live with that possibility or with the guilt that you are likely to feel. And therefore, I encourage all Barbadians, if you think you have the symptoms, don't hide it. Try to be truthful with those coming around doing the survey. You will get exceptional care. And I'm speaking from personal experience, not just somebody who's gone on tour of the facility. We have to be prepared to take the steps necessary at this time to ensure that we beat back COVID in Barbados. Barbados is in a battle to save every citizen. We are in a battle to save the society and the country, and all of us have a responsibility to act to make sure that we do what is right. So we wear our masks, we sanitize, we wash our hands, we stay 6 feet away from strangers. We are very careful in our households with family members because that's where we let our guard down. And when we think we could be sick, then we get the care that is necessary to save our lives and to save our loved ones. Well, that brings us, I think we're getting the questions up on screen now. I'm not too sure if the public can see them, but how many individuals are there living in your household, and what are their ages and genders? How many persons are there in your household who may have experienced the following symptoms in the last week? Headache, abdominal pain, pain behind the eyes, muscle and joint pains, nausea, new bleeding from the gums when you're brushing your teeth, blood in your vomit, swollen glands, rash, rapid breathing. Sometimes the symptoms are not so severe, they're much more mild, and you think that you just have allergies or maybe a fresh cold or something like that. Be conscious of that as well. Have any persons in your household experienced any of the following symptoms? If yes, we are going to ask you whether you've had them in the last 14 days, and persistent fever, a sense of fatigue, bad feels, loss of sense of taste, loss of sense of smell, recurrent headaches, shortness of breath or difficulty breathing. You find that you are a little out of breath when you go to do something that normally wouldn't give you any trouble, dry cough, not a racking cough, but a dry cough, sore throat, or dripping sinuses, and a lot of people at this time can mistake that symptom for allergies. How many people are there in your household who have the following illnesses? And remember, we've said that elderly people are particularly at risk because they're the ones who have the chronic non-communicable diseases in the majority, and that then acts as a complication with COVID-19. Dementia, chronic respiratory disease or asthma, hypertension, high blood pressure, sugar, diabetes, cancer, chronic kidney disease, are you on dialysis, cardiovascular disease, bad heart, stroke, any of those kinds of conditions. And I've put them in the vernacular so that I connect with everybody. And are you willing to take the COVID-19 vaccine? Because this is now a real possibility. Do you want to take it? Would you be interested? And if you're not, well, tell us why not. So those are the kinds of questions that the Ministry of Health and the University of the West Indies are going to be asking you. The questionnaire is longer than that, but I thought that I would give you some example of the health-related questions. There are also questions related to environmental conditions, specifically for dengue. Do you have containers in your yard that could be collecting water, old bathtubs, old fridges, old stoves, bins, big tubs that you are planning to water the garden with? Do you have plants that are catching water and therefore could be breeding mosquito larvae and so on? So there are a lot of questions, and these are intended to help you. Seek and save. Seek and save. That's what this operation is about. Now, all over the world, COVID has disrupted social activity. It has decimated economies. It has overwhelmed healthcare systems and hospitals. But it has also had significant personal impacts. Many of us and many people fear COVID. They fear their lives. They fear the loss of loved ones. Many people are concerned about the implications of getting the disease and the social stigmatization that may result from it. They are looking about how they can feel a sense of peace and continued wellness given the plethora, the flood of fake news on social media, given all of the news on traditional media every day, all day, about increasing COVID cases all over the world. This makes people anxious, fearful, it creates stress. Really, how can people cope? How do you manage in the context of everything that is going on with fears that are natural? How do you manage now that you are going to be on pause in your homes and can't really go out, particularly the elderly? These are the questions that I am putting to Dr. Joy Su, who is a consultant psychiatrist at the Psychiatric Hospital here in Barbados. But she is not responsible for patients in residence. She has the broad responsibility for community care. And therefore, she is well placed to tell those of us who are going to be in our communities on pause from the 3rd to the 17th of February, how we can manage our time and ourselves to minimize stress, fear, anxiety, and to cope, to still feel a sense of peace, mental well-being, and general wellness. Dr. Su, I believe that this is your first time with us in the COVID information update press conferences, and I welcome you. I'm trying to introduce more of the staff and specialists with the Ministry of Health and Wellness so that the public can see that this is a whole of ministry and indeed a whole of government approach to dealing with COVID. Dr. Su, thank you so much for coming. We look forward to hearing advice which is extremely important in the context of the upcoming pause and in the context of COVID generally. Good evening to you.
Good evening, everyone. Good evening to my fellow Barbadians and visitors to the country. Good evening to my fellow presenters, and thank you so much for that introduction and this opportunity to speak. We have experience now, based on what happened with last year's pause, as to what kind of mental health outcomes can result as a result of being in the pause. So while that was happening, we had a number of people who presented with problems with anxiety, with insomnia or difficulties of sleeping, and persons who after the pause presented in increased numbers having depression. So today I would like to give you some basic coping mechanisms that you can use to help you to get through this pause. And then I would like to reassure you that if you are having difficulty coping or functioning as a result of mental health problems during the pause, that we do have services available that will continue to be available to address those concerns. So first things first is coping. I would like for everybody to have a plan for communication. So it is a good way of coping, a good way to relieve your anxiety and stress, to have somebody that you can talk to express your feelings. So express your feelings, talk about things that were bothering you during the day. And if you could at least find one person that you're able to do that with, that would be good. Whether it's a person in your household or it's someone who you can speak to via Zoom or WhatsApp chat or any kind of other communication that you could use. If you're a person who is not comfortable necessarily, you're not accustomed to really talking about your feelings like that, and that's not something that you want to try, as an alternative, you can try writing your feelings down. So keeping a journal. And some people will say, hey, if I keep a journal, somebody might read what I'm writing in the journal. If that is how you feel, you can also just keep the journal, write what happened to you for that day, how you felt about certain things. That gives you the opportunity to reflect on what happened that day, what worked for you in terms of coping and what did not, so that can inform what you would do the next day to help you to better cope for days going forward. When you're finished that, if you want to, you can delete it if it's on any kind of digital device, or you can tear it up if it's on paper, because the important part is being able to express and get those feelings out. And in that action of deleting it or tearing it up, you're also kind of giving yourself closure on that situation and being able to move forward. So the other thing you have to do is things like groups. If you are part of a social group or a club, it doesn't have to be all at the individual level. In talking with persons, I've realized that those persons who belong to clubs, who kept in contact, who the clubs would have facilitated having meetings, checking in with their members to see how they were doing, that was also helpful. And it could be the church. It doesn't just have to be routine church services, but maybe you can just have a simple Zoom meeting with your church members, just to check in, let them ventilate their feelings, see how everyone is doing. Also, I want to say to persons, do not be embarrassed to express your feelings. Don't be embarrassed if you're having trouble coping. It is a stressful experience for everyone, and different people will cope at different levels. There's nothing to be embarrassed about having mental health challenges. So I would encourage everybody to speak out about those challenges. And then there's some things that you can do as a part of a routine for your days that can help you to cope as well. So forming a routine, especially for children, is quite important. Try to maintain as much normalcy as you can obtain within the situation. So if your kids were accustomed getting up to school at a certain time, getting dressed, eating breakfast for a certain time, try to maintain that same normal routine for them, because they need to feel as if there's some kind of stability, even though that there are changes and, you know, scary things happening around them. But in your routine, try as much to involve exercise. Taking care of your physical health is very important for mental health as well. And in fact, even though we like to talk about mental health and physical health, these things are interconnected. They're not different things, it's health. So physical exercise, I like to say aerobic exercise for at least 30 minutes a day, and that can be at the least 3 days a week. And it is good that the Attorney General would have mentioned that, you know, have some avenues for exercise, although I don't think everybody needs to be out on the road or at the beach or so on to exercise. You can do simple exercises at home that help as well. And since we had last year, when we had a lot of nations going into lockdown, you find out that there are a lot of resources available online for that. You can download apps that will give you exercise programs that you can follow on a daily basis. You just have to find one which is more suited for your level of activity so that you don't overdo or do too much too fast to cause yourself any problems. But as I say, aerobic exercise, so things like walking, you could be skipping, if you have a bicycle, the stationary one at home or a treadmill, those things are good things that you can engage in. And besides exercise, you have to maintain a healthy diet. Make sure that you're eating properly, and know that there were some people, even though we said the supermarkets would remain open, there were still some people rushing to buy things. The problem with that is that sometimes the things are there in the house, and if they're there in the house and you're not going anywhere, you're going to be eating. But overeating, which would lead to problems with your physical health, will also affect your mental health. So try please to maintain as healthy a diet as possible during this time, and a balanced diet. Also, if you're on medications, please remember to take your medications as prescribed. And also remember to get enough sleep and rest. Maintain your sleep-wake cycle the way how it was before, meaning if you are accustomed to going to bed at 9 o'clock, try to maintain that consistently. Make sure that you're not staying up late, for instance, watching TV, binge watching Netflix or something like that, because you feel you have the time since you're not going out to work. Because those things can affect your sleep cycle down the road. And also when it's time to go back to work, you might have difficulty readjusting then to get up to your early times to go back out to work. So try to maintain your sleep cycle as well. So there are other little basic activities that can be done. Now we have a whole set of apps also online that deal with meditation. Just taking like a 5 minutes break out of your day to just meditate, withdraw from everything that's happening with yourself, around yourself, and focus on yourself, your breathing, and so on. These are activities that can help, as well as things like yoga, certain types of exercises, Tai Chi, and so on. As I said, these are available. These are their apps that you can now download that help with this. Things like Calm and Headspace, those are some of the names of the apps. Now, this is an opportunity that presents you. Some of you might have had a creative project that you wanted to do for some time, but you kept putting it off, but it never seemed like there was enough time with your home responsibilities and work responsibilities. So this might present an opportunity for you to be able to work on that. So you might have had an art project, you might have wanted to learn a new dance, you might have wanted to do some gardening. So these are things that maybe you play an instrument and you want to learn better how to practice your instrument. So These are things that you can work on. Creative activities also help to relieve the stress and the anxiety. And then listening to music in itself is also relaxing. Certain people will like different types of music. So you have to know which music is relaxing for you. But then there are also studies out there showing that classical music is very good for this purpose. So you can try listening to music to try to calm down if you feel those feelings of anxiety coming up. I think it's important to, from the point of view of depression as well, for persons to get sunlight. So a lot of persons stayed in the house completely during the last pause. They didn't go outside, so they weren't getting any sunlight. I think that has an effect too in terms of causing depression or feeling sad. So persons, I encourage you to at least go outside for part of the time, even if it's just outside your home or in your veranda, get some fresh air, get some sunlight, and this will also help with coping. And then there are other things like aromatherapy. But overall, I think what is important is that we focus on the positives that we still have in our life. I know that a lot of persons are frustrated now with the amount of restrictions. They're wondering when this will all end and how much more of this that you can put up with. But instead of focusing in on those negatives, try to concentrate on focus on the positives that you still have in your life. Say the love of your family, your friends, and the ability to still communicate with them, even if that may not be face to face. So accentuate the positive in your life. So those are some of the basic things that you can use for coping. Of course, there are certain persons who are in special circumstances that may need to do other things, and that is something that I have been trying to discuss in other forms of media as well, but I would not go into at this point. But I'd also like to make sure that you know that there are access to services. So our community mental health services, we have a mental health clinic in each of the polyclinics. Our services are still open and will remain open during the time of the lockdown, with the exception of Brantford Tate Polyclinic, which will not be operating from the polyclinic, that is now operating from the psychiatric hospital. And Glebe Clinic next week will operate on Thursday instead of the usual Tuesday, with some of the Tuesday visits also being done by home visit. For those persons who are quarantined as a result of being exposed and who might have difficulty coping with the quarantine period and waiting for test results, we also have a service. We are fortunate to have had volunteers from private and public associations. So for instance, the Barbados Association of Professional Social Workers, who are all trained in psychological first aid, who have been volunteering and offering their services with counseling for persons in quarantine and persons who are referred through the hotline. So that is available to the general public via the hotline, and for persons who are in quarantine via the staff who manage the quarantine if you point out to them that you need this type of intervention. So we are trying to do everything to make sure that mental health for everyone is covered and that no one will be left out. And if you need the help, that you can reach out and help will be there for you. Thank you.
Thank you very much for that excellent information. I just want to be sure and repeat, the Glebe Polyclinic, the mental health clinic will now be on Thursday. Did I understand you to say that?
It will only be on Thursday for next week. After that, it will resume on the regular Tuesdays.
Thank you. And the Brantford Tate Polyclinic at Blackrock will now be operated from the psychiatric hospital.
Yes, for the duration of the pause, Brantford Tate Polyclinic will be operating from the psychiatric hospital. Right, the psychiatric hospital services are, of course, still available. So you have the emergency services of the assessment unit available. So those are still in place.
But anyone who feels stressed or fearful or depressed can access these services.
Well, if it is an emergency, I would encourage you, if it's an emergency, you can go to the psychiatric hospital. If it's not an emergency, you can try to access the services by one of the other avenues I pointed out. So either via the community services, via the hotline, or if you're in quarantine, via your nurse or doctor who is managing your quarantine facility.
Thank you very much.
Me, and I will assign somebody.
Okay. Wonderful. Thank you very much, Dr. Sue, for this very useful information that you shared with members of the public today. I think that these are some key strategies for managing during the pause. We have with us the Barbados Advocate, CBC Barbados Today and the Nation newspaper. And we are going to open our panelists now, or discussants, to questions from members of the media. And we did have somebody who was phoning in a question as well. So, ladies and gentlemen of the media, please pose your questions at this time.
Good evening, Ambassador Thompson. This is Barry Allen from the Nation newspaper. I have a question for Dr. Jerome Walcott from the subcommittee, please.
Yes, Barry, thank you.
Hi, good afternoon, Mr. Walcott. My question is regarding the Operation Seek and Save in terms of logistics. Can you give an indication as to how many persons from the public health perspective will be trained? You mentioned that you're going to train them, and well, have you actually started that training? And can you tell us how many persons will actually be trained to do the taking of swabs and these public health requirements?
Thank you, Barry. We already have persons who are trained, and the training is ongoing. We are aiming to see if we can train as much as 60 additional people so that we can have mobile teams. Currently, we have mobile teams of 3 and 4 persons, and we're trying to increase that number to see how many mobile teams we could have so that we can have them going all over the island. As I said, the analysis will be done on a 2-hourly basis as we get reports. And we're hoping then for the mobile teams to go to persons where they are and do the testing. I believe some persons are concerned if they need to be in a clinic to do a testing, and I'm sure that all of the public had seen globally where testing is done. It can be done in a car, it can be done through a window, it can be done at your doorway to do this. So the training has started and is continuing. Thank you.
And a second question for you, Dr. Walker. As you would be aware, there are some persons in Barbados who require medicinal facilitation because of illness. Like, let's say, persons who would require dialysis. During the curfew, how would these persons be facilitated if they require treatment? As you know, some persons who have renal failure in Barbados require particular levels of treatment. How will they be facilitated during the curfew?
As I know it, for the dialysis, those who require dialysis, there's normally a schedule, an appointment system, and the QEH provides transportation for persons who are incapable. And I know that they send not ambulances, they send the vans for them to bring some of those persons who require to be brought to the hospital for dialysis. That system is in existence, and I'm certain it will obviously continue during the lockdown period.
Thank you.
Questions are coming in. No member of the press is raising their hand. Dr. Sue, there's one for you. Would you be kind enough, please, to give the hotline number? You referred just now to a hotline that members of the public can call. Would you please give us the hotline number? And then, Dr. Walcott, I have some questions that somebody sent for you.
Okay, just to clarify, that is actually the COVID hotline that I was referring to. The doctors who work for the hotline, they have my contact information. If anyone calls the hotline who they flag as having mental health issues and who is willing to accept the intervention, they're referred to me, and I assign someone to call that person and arrange the intervention for them.
Thank you.
The national COVID hotline that I'm speaking about.
Dr. Walcott, the questions here are, how will this private information be treated? Who else will have access to it? Are the data gatherers under a confidentiality requirement? Which arms of the state will be given the information? Is there a possibility of some legal liability, for instance, if you're an undocumented immigrant? Undocumented person? Are the data gatherers being guided and supervised? And if people refuse to respond, what then?
I'll take the last question first, obviously, because there are a number of questions that you give me all at once. If persons refuse, we can only encourage them. And as I said, we can cajole them, we can encourage them, but at the end of the day, that's the individual's the decision. We can't force you. to comply but we will certainly hope that you will accede to our request. The data will be going to the Ministry of Health and Wellness. As it relates to the privacy, that matter was discussed, and obviously the students will have to make the necessary clearance as it relates to that. We've also taken insurance against some of these students in case something should happen to them. As I said, when they've completed this, they press the link. The drop-down menu provides the instrument or the questionnaire. It is completed when they've finished. They just press submit, and that goes then to the database where it is analyzed. And obviously, there are the issues of confidentiality. We recognize the matters related to patient confidentiality, and all of the measures will be in place to ensure that. I don't remember the first two questions.
Undocumented persons, how will the information be treated?
Well, we are not looking at we are not saying that you have to be we're not looking at only Barbadians. We are trying to identify and come up with the incidence of the disease in the society. And obviously, if they're undocumented persons and we didn't include them, and they turn out to be positive and be hiding in the society, it makes the situation worse. So that does not come into this situation. All persons who we find in a household, we will be asked, treated the same way.
Members of the media, we have the Advocate, CBC, Barbados Today.
If no one will ask a question, I have one for the Attorney General, please.
Please go ahead, sir. Mr. Ali?
Yes, Barry, go ahead.
Yeah, Mr. Attorney General, we've had the unfortunate situation within the last 48 hours again, one of our police stations being affected by the COVID-19 pandemic. And my question to you is, what level of concern do you have that our law enforcement continues to be affected by this virus and we have another station being affected? I'm sure that members of the Royal Barbados Police Force may have reached out to you regarding some concerns. What are you hearing from the constabulary, and how concerned are you personally that this continues to affect law enforcement?
I sometimes think that the public thinks that police officers are made of wrought iron or Wallaba posts or something like that. I'm not trying to be flippant, but police officers are members of the Barbadian society, just as nurses and doctors and prison officers and people who work in stores. They engage with the public, and in many respects they engage with the public more than most people. So the fact is that police officers are susceptible to the same illnesses as every other Barbadian, and they are susceptible to contracting the COVID-19 virus. But let me say that notwithstanding that we have had some challenges, and I acknowledge that we have had some challenges, firstly, the details of those challenges, you will appreciate that I'm not exactly excited about discussing in the public forum, but what is more important is that from as far back as February last year, we recognized that there was the potential for the COVID-19 virus to affect the Royal Barbados Police Force. And we put in place plans then, and those plans are being carried into effect now. I'm satisfied, and I'm briefed on an almost daily basis by the Police High Command as to the ability of the force to deploy officers, and that continues. You will know that the police force has been on a heightened state of alert given the challenges that we had at Her Majesty's Prison. Happily, those matters have cooled down a little bit, and that has allowed us to refocus. But the police have been on the front line in terms of monitoring people complying with the COVID protocols. We've had to stand up patrols to specifically monitor the various quarantine sites and so on. We've had to provide security for isolation centers, in addition to doing all of the regular work. We've responded by calling back out police officers who were on vacation leave. We've canceled leave. Police officers who were not normally on the front line, such as band members and so on, they have, and this has happened every time we've had challenges. At Christmas it happens. Police bandsmen come out to the front line and do day-to-day policing activity. So I'm confident that Barbados continues to be properly and adequately policed. I will say, though, that this administration has never been one to cower behind difficulties, and we try to be forward-thinking. And with that in mind, we have authorized the Commissioner of Police to reach out to a number of retired police officers and encourage and invite them to come back to the force to participate in activity that police officers are currently doing, but that don't need specifically to be done by police officers. So such things as taking calls. There are a number of duties that our police officers do that are not specifically required to be police officers. It is not commonly known that police officers pump fuel for police vehicles. And these are trained officers. So we are going to be bringing back a number of retired officers who have their country at heart and who are willing to come back and say, let me come back and do some of these policing jobs so as to be able to ensure the force that they're policing and the police officers that are required to do that policing are able to be fully met. So yes, we are concerned about police officers getting COVID, but we're concerned about nurses getting COVID too. We're concerned about prison officers getting COVID. We're concerned about everybody getting COVID. Suffice it to say that we have taken all of the precautions that we need to take. Our police are provided with sanitizer. They're provided with PPE, so there's absolutely no shortage of that. And that will continue. Barbados is fully and adequately policed.
Just to indicate that, as you would be aware, the Ministry of Health is monitoring and has asked us to let the public know that all enumerators will be trained and certified in health data management with the City Corps CITI Collective Institutional Training Initiative, as is required for handling of health data. They will receive a certificate of completion. You should also note that all information gathered will be protected under the provisions of the Data Protection Act. I think I heard the Barbados advocate about to ask a question, and Minister Walcott, another question has come in for you, but we'll take the question from the advocate first, please.
Yes, my question is also to the Attorney General. During the lockdown, you didn't mention courts, such as the magistrate court, being open. So what will happen for persons who still have matters before the court during the national lockdown period?
Talking about the current period or the one that's coming on the 3rd?
The one that's coming.
Okay, let me say that from the time we started, from the time we imposed the curfew situation, which started at the start of the year, we had to take a decision that we were going to limit the interaction with the courts. And the truth is, our courts can function in a limited way, and one thing that COVID has brought to the fore has been disposing of a number of matters through Zoom and so on. So that is likely to continue. But of course, the public service is going to be reduced to a skeletal level. And therefore, to the extent that our courts require to be staffed in one way or another by clerical officers, legal assistants, and so on, obviously, only if that work can be done at home would it be done. In relation to the public service, generally, let me remind you, and our COVID directives, in respect of the public service, simply says one thing, that the public service shall operate at the level and at the times required by the head of the public service. So I've spoken to you about bakeries, I've spoken to you about all kinds of other enterprises. You'll notice that none of them are public sector enterprises. the head of the public service has been engaged with his various permanent secretaries, and I believe that by now they have or are about to settle a list of all of the government departments that will remain open and at what level. And therefore, while as Attorney General I have some authority over the registry and the court system, the head of the civil service determines to what extent those agencies will have staff. And my anticipation is that they will have limited skeleton staff available. But in terms of people going to the court to hear matters, I believe that it is the intention of the Chief Justice, having consulted with his judges, that that should be reduced to a minimum. So subject to his clarification, I do not anticipate that hearings in person will take place during the next 2 weeks.
I have a question for Dr. Walker, if you would allow, Ms. Thompson.
But I'm only allowing for another 5 minutes because we're going to close in 5.
Okay, Dr. Walker, can you tell us what consideration government has given to the fact that some persons may not want to or may not want to allow themselves to be tested or swabbed in the community as you start Operation Seek and Save? I mean, what will be done or what can be done if a person says, I do not want to be tested for COVID-19?
Barry, as I said at the outset, that we can only encourage persons to cooperate. But I know that under the order, I don't know if the Attorney General will speak to it, the CMO has the powers if he figures that a person is likely to have COVID, is living in a situation with other persons or interacting with other persons who might then be exposed to it. I believe the Chief Medical Officer has the right under law to intervene. I don't know if the Attorney General wants to speak a bit to that.
Asymptomatic and the persons do not believe that they may have COVID.
The person is asymptomatic.
Yes.
Asymptomatic. We are looking in, Barry, as we do the survey, we are looking for symptomatic individuals. We are looking for symptomatic individuals. If you are speaking of a situation where there's a case of COVID in the community and an individual is a primary contact and is asymptomatic, again, and is refusing to have a test, the Chief Medical Officer can intervene to protect the greater good in the community as opposed to that individual. I don't know if the Attorney General wants to speak to it.
I think that is absolutely correct. A noted politician once remarked that the Chief Medical Officer is perhaps the most powerful person in Barbados, and a person, there's a context to this. When we started this entire process, we had to take into account that an individual may be uncooperative, may not want to assist, and therefore in our COVID order, which overarches the directive, our COVID order provides that if the CMO has reason to believe that any person has or may have COVID-19, that he has the power to put that person into quarantine or isolation. So while we are collaboratively dealing with the people in our communities, at the end of the day, we're not a police state, but at the same time, individuals don't have the opportunity to say, well, I may be coughing and sneezing and have all these symptoms, but I ain't coming away. That's just not on. The Chief Medical Officer has the lawful authority to take that person and put that person into isolation or quarantine and for medical treatment.
Questions are going to go to you. I have to admit that one is mine and the other one has been sent in by WhatsApp. I'll go to the one that has been sent in first. Has the government of Barbados signed on to any kind of development assistance conditions that would require our population to be vaccinated? There are lots of theories and conspiracy theories out there about vaccination.
Has not signed on to any such agreement.
Okay. And my question to you is, what advice would you give? I know from my own life experience, from my experience as a parliamentarian, there are people who live in communities and households where there are several generations living in the house. You can have 12 members of a family living in a 2-bedroom, 1-bathroom house, or a 3-bedroom, 1-bathroom house in the housing areas. People who are close to one another, and your grandmother, mother or father, mother and father, and children, and so on. What advice would you give to families living in those close settings to keep themselves safe and protect themselves and their older relatives during this period of pause, please?
Well, obviously the living conditions are what they are, but they can insist, I know that especially if they're living with elderly persons, they must continue to wear their mask. If they're going out, they never know what they're bringing back in. They should wear the mask in the house, protect those elderly relatives in the house, the sanitizing of their hands, ensuring that they protect those individuals. Regrettably, we've had similar situations in the country recently, where we've had a situation where 9 members in one family out of 11 living in 2 houses in close proximity. We've had another situation of 10 family members where they are living together, and obviously they're taking it home. The elderly persons are exposed. So I would only encourage them to, even though you're at home, their elderly relatives that are near and dear to you, protect them. Wear the mask indoors, wash your hands, explain to them. Some elderly people might feel strange that you're wearing a mask around them, but you have to just tell them, talk to them. While you're doing it to protect them, that you're not scorning them, but you're protecting them. I can only encourage them to do that.
Thank you very much. I know that the Attorney General has one final remark which he'd like to make, and that is going to be our closing comment this evening. Attorney General?
Thank you very much, Liz. The questions are coming fast and furious. Let me say, for those individuals who have been asking about fish markets, the fish markets in Barbados are going to be closed during this period, and all of the other markets are going to be closed during this period. So, and fish markets are going to be closed for the purpose of retailing fish to the public, and also for the purpose of fishermen landing their catch. Regular agricultural markets and other markets are also going to be closed for any reason at all. And we've said that supermarkets are going to be open, select mini marts are going to be open. The question keeps coming, are we going back to the alphabet system? Now, we have not said that we are, and therefore you must understand that we are therefore not stipulating. In other words, unless we say we're going to the alphabet system, we're not going to the alphabet system. So you need not anticipate that some complex set of arrangements with M's shopping on a Thursday is in the offing. You can shop at your leisure at any supermarket of your choice or mini mart of your choice within the hours that have been stipulated, 8 to 4. Thank you very much, Liz.
You're welcome. So, as is my habit, I'm going to close by giving you the key takeaways for today. They're coming primarily from Dr. Sue, who joined us for the first time, and it's about mental health and mental well-being, and finding a sense and a zone of peace in the midst of the lockdown and all of the talk about COVID, which creates such stress and anxiety. Talk to somebody about how you feel. Keep a journal, whether it is online on the computer or whether you write it down and then delete or tear the paper up after. Listen to music, do something creative. I'm particularly keen on trying traditional Barbadian recipes, and perhaps people can exchange recipes and do things like that. Young men can teach sons how to make traditional kites, trash bone kites. Connect with a group or club, set up a WhatsApp group, a chat. Connect with a group or club, a church group, or any other kind of group, perhaps people who you have a common interest in with the gym. Get some exercise. Even though you are inside, make sure the doctor said to get some exercise. Keep your routines and cycles for order and organization, and to help you slip back into the work rhythm when you have to go back to work. Make sure you get adequate sunlight and fresh air. You're being asked to maintain your familiar routine. Yes, I did cover the key takeaways from Dr. Sue, and we are grateful for her assistance. If you need support during this period, the psychiatric hospital, the polyclinics, and the specialist medical practitioners are there to support you. You are asked by Dr. Walcott to cooperate with the persons who are conducting the survey. You are assured that it is completely confidential and that they are not targeting any particular individual. It really is about health and wellness, seeking and saving everybody who might be at risk. The Attorney General's key message is that from the 3rd to the 17th, the country will be on pause to protect yourself and your family. Stand inside. Stand at your house and don't go at nobody else. That is the key message for all of us. Stay at home during this period. Just let the essential services that have been outlined, and you are going to be messaged about receive the public service announcements and get messages on your phones, as you have been doing, getting various messages to guide you through this period as to what you should and should not do, what the rules are, what will be open, what will be closed, and so on. We hope that you have found today's press conference useful. If we stick to schedule, if nothing major breaks in the intervening period, we should be back with you on Tuesday evening at 5 o'clock. At that time, I believe we may have started the shutdown, the pause, the period of pause. And I remind you that to beat back COVID, Barbados is in a battle to beat back COVID. We all have our role to play. And a key measure to protecting ourselves and our families, particularly older relatives, is wear your masks right. Wash your hands often with soap and water. If you can't get to soap and water, sanitize. And stand 6 feet away from people who are not members of your own household. And we're going to add one more to that. Be careful with members of your own household. Exercise caution and care around them so that they are not put at risk, particularly if you are an essential worker or someone who has had to leave the house. And for those who have been asking, I have been asked to assure you that Pearl's shop will be closed during this period. Fred and Pearl are going to stand inside. Minister Simmons is asked to make alternative arrangements for his liquid refreshment. Good evening to you.